One of the most legendary and iconic weapons of the warrior class is undoubtedly the bow and arrow. During the Indian Wars, an experienced warrior could shoot up to 20 arrows a minute, slightly above the trained soldier who could shoot around 15 rounds per minute through his Springfield Model 1873 service rifle. U.S. Army surgeons had just experienced 4 long years of frontline surgery, extracting bullets and shrapnel from wounded soldiers during the Civil War. But they had little experience with the type of wounds arrowheads were causing in this war against the Indians. From the medical journals and reports at the time, we know that bullet wounds, if it didn't kill the soldier outright, usually required cleaning, but not immediate surgical intervention. Arrows, on the other hand, pierced the body wall through well-defined smooth slit wounds and lodged deep in tissues. This resulted in severe internal bleeding. Therefore, to treat arrow wounds, Army surgeons had to modify their practice, often having to operate at the site of the wounding. Arrowheads were attached to their shafts with narrow wrappings of animal tendon, which disconnected when moistened within the body. Contrary to surgical advice, victims would often remove the shaft and leave the abandoned arrowhead to act as a constant tissue irritant. If immediate hemorrhage did not occur, the overlying tissue would reorganize and disrupt the path the arrow took. Arrowheads occasionally became encysted, whereby a cyst would form, trapping the arrowhead, which required major operations to retrieve them. One tribe's arrow wounds caused different types of injury than another. Apaches, for example, often used stone arrowheads which shattered bone, whereas Plains Indians used iron arrowheads which embedded in deep tissue and bone. Several tribes, including the Comanche, Apache, Seminole, and Cherokee, were known to poison their arrows with a variety of toxins, including rattlesnake venom. Surgeon Major Joseph H. Bill explains that limb injuries were the most common, followed by chest and abdominal injuries. The limb injuries were the least fatal, with less than 5% mortality. When the arrow passed clean through a limb, treatment was by simply cleaning and dressing, and these wounds healed quickly. On the high, dry tablelands of New Mexico, this usually took only 2 days. More commonly, the arrow would embed in bone. If it was not immediately removable, the limb was splinted and a type of tube drain inserted. Strong compression bandaging was used to restrict limb movement and prevent burrowing of the arrowhead. The wound would then be re-explored, and if the arrow could not be removed, as was often the case, a general anesthetic, usually chloroform and ether, was administered at about 7 to 10 days post-injury. At operation, great traction was often necessary to remove the arrow. Dr. Bill invented specific arrow-extracting forceps, which locked around the arrowhead. Approximately half of the chest injuries occurred with underlying lung injury, which was usually fatal. Arrows tended to lodge in the posterior ribs, rather than traverse the chest cleanly. The surgeons would locate the affected rib by gently tapping the front part of the rib and feeling the back part of it. The arrowhead was then removed together with the part of posterior rib involved using a trephine. In one case, Dr. Bill could not remove the arrowhead, and the soldier made an uneventful recovery. At an Army medical examination several years later, he was certified as completely fit. Abdominal injuries had a mortality rate of approximately 90%. Death was usually due to immediate hemorrhage or subsequent peritonitis. Mexican soldiers, unlike U.S. cavalry soldiers, were well aware of this and wrapped blankets around the abdomen before going into battle with the Indians. When soldiers survived the initial hemorrhage and an arrowhead remained within the abdomen, a mini laparotomy was performed. The surgeon would pass a looped wire over the arrowhead in order to cover the barbs and avoid tissue damage as it was withdrawn. If bowel contents were seen, a full laparotomy was performed, and any perforated bowel was repaired with catgut or thin gold wire. Sometimes, it was impossible to remove the arrowhead. One survivor had persistent urinary incontinence for years after his injury. Removal of a large bladder calculus with an arrowhead at its center cured the man. Head injuries are almost invariably fatal. However, occasionally an arrow would hit the side of the head and cause a depressed skull fracture without underlying brain injury. At other times, men were not so lucky. A soldier of Company E of the 4th Cavalry was on duty as one of the male stage guards from Fort Chadbourne. About 20 miles from Fort Concho, Texas, the stage was attacked by a band of Comanche. This soldier was wounded by an iron-headed arrow, which entered his head to a depth of an inch or more, causing intracranial bleeding, which killed him quickly. Private Snowden, 14th Infantry, was one of a party surprised by Apaches on March 22, 1866, while en route from Maricopa Wells to Fort Goodwin, Arizona. He was struck in the back of the head by an arrow, which penetrated the skull, and 9 days later reached Maricopa Wells, weak and fatigued, but unimpaired in intelligence. He believed the arrow point to be still within his head, since in pulling on the shaft, after receiving the injury, nothing but the shaft came out. The usual treatment was being given with success. During the scalp examination, a small swelling was found on the left side of the back part of the head, near where the occipital and parietal bones meet. Pressure caused a small quantity of clear matter to exit the wound. This was enlarged, and a probe passed into it was made to feel along the fissure in the bone when it struck something metallic. The cranium was laid bare by a crucial incision, and with considerable difficulty, a hoop iron arrowhead 1 inch long and a ½ inch in width was withdrawn from the brain. A large amount of pus followed it. After the operation, the right side of the body was observed to be paralyzed. The patient's condition fluctuated, but the first week in May his improvement had been such as to cause belief in his ultimate recovery. On the 7th, he ate something which disagreed with him, and gradually grew worse until the morning of the 13th when death ensued. The post-mortem showed that the brain tissue to the extent of 3/4 of an inch around the track of the arrow point was softened and disorganized. Private William Drum, 14th Infantry, was wounded in a fight with Apaches, November 11, 1867. One arrow entered over the cheekbone of the left side of the face and passed along the lower border of the orbit to within ½ an inch of the nose. Another arrow entered through the tendons of the latissimus dorsi muscle on the right side and passed directly backward toward the spine, under the deep muscles, penetrating 24 inches. On the 19th, the arrow point was cut out, the parts healed by first intention, and on December 3rd, the patient was returned to duty. Nat Crabtree, a citizen of Montana while searching for cattle, April 24, 1868, received 9 arrow wounds. He was conveyed to Camp Cook. Some of the arrows had been removed by his friends, but 5, one of which had penetrated 10 inches, were taken out at the post. The man died a few hours after admission. Private Osborne, 2nd Nebraska Cavalry, was wounded in a skirmish with Indians near Pawnee Reserve, Nebraska, June 23, 1863. 8 arrows entered different parts of his body, and all were extracted except the head of one which had entered at the outer and lower margin of the right shoulder blade and passed upward and inward through the upper lobe of the right lung or trachea. The hemorrhage was so severe that all hope of his recovery was abandoned. The patient, however, rallied, but continued to suffer great pain on swallowing or coughing, and occasionally spat blood. In July 1866, more than 3 years afterward, he called upon Dr. J.H. Peabody to be examined for a pension. Upon probing through a small fistulous opening on the top of his chest, the point of the arrow was found resting against the bone about 1.5 inches below. The head lying flat against the trachea and esophagus, with the carotid artery, jugular vein, and nerves overlying it. After some difficulty, the point of the arrow was raised above the sternum, and it was extracted without the loss of an ounce of blood, the edge grating against the sheath of the innominata artery during the operation. His health underwent a remarkable improvement. Dr. Peabody, in January 1869, reported him perfectly well. His pension was not allowed. Dr. Kilbourne, in an address delivered before the Buffalo Medical Club in 1881, tells of a U.S. officer who received a wound from a Comanche arrow. He remarks, "The weapon pierced the upper part of the right chest and passed nearly horizontally through the lung, the point protruding at the back between the shoulder blade and the spine." He informed me that at his own request, a silk handkerchief was fastened to the shaft, which was then pushed through his body, dragging the silk after it through the whole extent of the wound. He recovered and served actively in the Army for many years after. To Ka K-10, or He That Kills His Enemy. An Indian scout at Fort Buford, Dakota, received January 3, 1870, an arrow wound in the pelvis and abdomen. The projectile entered from behind and ranged upward. The shaft, which penetrated 12 inches, was pulled out by the patient, but the head, which penetrated 3 inches deeper, remained in the wound. The case received surgical treatment and progressed favorably until peritonitis supervened, and death ensued on January 18th. Surgeon J.H. Bill describes the apparatus devised by himself and in use by other surgeons for the extraction of arrows. The principle is that, using the arrow shaft as a guide by which to find the arrowhead, it shall be snared or seized in some way with a wire or loop or similar device by which the traction can be applied to the arrow point, when it, with the shaft attached, can be withdrawn. Dr. W. Thornton Parker described the Indian method of removing arrow points when embedded in the wound. He says a willow stick is split, the pith scraped out, and the ends rounded so that they may readily follow the arrow track. The pieces are introduced so as to reach and cover the barbs. They are then adjusted, bound to the arrow shaft, and all withdrawn together. Some of the arrow wounds received by troops and citizens in the late 1860s. Private John Ahern, Troop L, 5th Cavalry, Camp Willow Grove, Arizona Territory, November 8, 1867. Slight arrow wounds in the back and left shoulder. He had recovered by December 9, 1867. Sergeant George Aldrich, Troop C, 2nd Cavalry, age 33 years. Pino Creek, Dakota Territory, December 1866. Wound to right lumbar region by an iron-headed arrow. Treated in post hospital at Fort Philip Kearny, Dakota Territory, and returned to duty December 31, 1866. Private Joseph Arkey, Troop Y, 3rd Cavalry. Engagement with Navajo Indians near Fort Sumner, New Mexico, July 9, 1869. Arrow wound of right shoulder, passing through below the deltoid. Recovered. Payanza, Indian Scout, Rocky Canyon, near Donner and Blitzen Creek, Oregon, March 14, 1865. Slight arrow flesh wound of the arm. Transferred to Camp Harney, Oregon. Recovered and returned to duty. Big Mac, Indian Scout, Rocky Canyon, near Donner and Blitzen Creek, Oregon, March 14, 1868. Slight arrow flesh wound of the arm. Transferred to Camp Harney, Oregon. Returned to duty. Private Frank Burr, Troop D, 3rd Cavalry, Sierra Diabla, Texas, in an engagement with Mescalero Apaches, October 18, 1867. Arrow wound of right forearm. Returned to duty. Private John Butler, Troop 1, 6th Cavalry, age 26 years. Paint Creek, Texas, March 6, 1868. Arrow wound of upper third of left forearm. Treated in post hospital at Fort Griffin, Texas, and returned to duty on March 11, 1868. Private Robert Clinton, Troop L, 3rd Cavalry. Engagement with Navajo Indians near Fort Sumner, New Mexico, July 9, 1869. Arrow wound of the back below the spine of the scapula. Recovered. Private John Cooley, Troop G, 3rd Cavalry, Purgatory Creek, Colorado Territory, October 3, 1866. Arrow flesh wound a few inches in length, on left side of the thorax. Treated in post hospital at Fort Garland, Colorado. Recovered. Returned to duty. Private John Craig, 5th Cavalry, Camp Willow Grove, Arizona Territory, November 8, 1867. Arrow perforating wound of the left hand. Transferred to Camp Mojave, Arizona Territory. Returned to duty. Private Bartholomew Creedon, 3rd Cavalry. Engagement with Navajo Indians near Fort Sumner, New Mexico, July 9, 1869. Slight arrow wound of the left arm. Recovered. Returned to duty. Private James Daly, Troop D, 3rd Cavalry, Sierra Diabla, Texas, October 17, 1867. Arrow. Flesh wound through the right thigh above the patella. Treated in post hospital at Fort Bliss, Texas, and returned to duty October 26, 1867. William Fee, a citizen, age 22 years. Crazy Woman's Fork, Dakota, December 4, 1867. Slight arrow wound of muscles of the right side of the abdomen. Treated in post hospital at Fort Philip Kearny, and discharged December 8, 1867. Private Gottlieb Haar, Company C, 18th Infantry, age 22 years. Crazy Woman's Fork, Dakota Territory, December 4th, 1867. Slight arrow flesh wound of the anterior surface of the left thigh. Treated in post hospital at Fort Philip Kearny. Doing well. Returned to duty. Sergeant John F. Hilmer, Troop L, 3rd Cavalry, age 24 years. June 24th, 1870. Arrow wound penetrating the right arm. Treated in post hospital at Camp Verde, Arizona Territory. Returned to duty in July 1870. Private Charles Hoffman, 6th Cavalry, age 28 years. Paint Creek, Texas, March the 6th, 1868. Arrow wound in upper third of the left thigh. Treated in post hospital at Fort Griffin, Texas, and returned to duty March 31st, 1868. Private George Johnson, Troop L, 5th Cavalry, Camp Willow Grove, Arizona Territory, November 8, 1867. Slight arrow wound in the chest over the shoulder blade. Transferred to Camp Mojave, Arizona Territory. Returned to duty. Rudolph Kenton, citizen, aged 25 years. Pinery near Fort Philip Kearny, Dakota Territory, December 18, 1867. Slight arrow wounds of the right leg and shoulder. Doing well December 20th, 1867. Recovered. Sergeant J.R. Ludlow, Troop G, 7th Cavalry. Arrow entered immediately behind the junction of the 9th rib with its cartilage and emerged about 3 inches from the spinal column, same side. Discharged from service at Fort Leavenworth, April 8, 1868. Private Edward Malone, Troop L, 8th Cavalry, near Camp Willow Grove, Arizona Territory, November 8, 1867. Slight arrow flesh. Wound above the hip. Transferred to Camp Mojave, Arizona Territory. Returned to duty. Lieutenant Thomas J. March, 7th Cavalry, Washita River, November 27, 1868. Slight arrow wound of the left hand. Recovered. Returned to duty. Trumpeter James Marshall, 3rd Cavalry, age 21 years. June 24, 1870. Superficial arrow wound of the right hip. Treated in post hospital at Camp Verde, and returned to duty in July 1870. Private Joseph Miller, 2nd Cavalry, Fort Reno, Dakota Territory, July 19, 1868. Arrow entered over the external edge of the scapula and protruded through the bicipital portion of the middle third of the arm, from whence it was extracted. Returned to duty. Private Hugh Morgan, 7th Cavalry. Engagement with Indians. November 27, 1868. Arrow flesh wound of the right arm. Treated in post hospital at Fort Dodge and returned to duty in January 1869. Private Clarence G. Morrell, 3rd Cavalry. Sierra Diabla, Texas, October 17, 1867. Arrow wounds of the right groin, side, and back. Treated in post hospital at Fort Bliss, Texas, and returned to duty on November 19, 1867. Private Daniel Morrison, Troop G, 7th Cavalry. Engagement with Indians, November 27, 1868. Arrow wound of the scalp. treated in post-hospital at Fort Dodge, Kansas, and returned to duty in January 1869. Bugler John Murphy, Troop M, 7th Cavalry. Engagement with Indians, November 14, 1868. Arrow wound of the right side. Treated in post-hospital at Fort Dodge, Kansas, and returned to duty in March 1869. Private Charles Murray, Troop F, 10th Cavalry, Beaver Creek, Kansas, August 21, 1867. Slight arrow wound of the left leg. Treated in post-hospital at Fort Hays, Kansas, and returned to duty. Corporal Thomas O'Brien, Troop F, 6th Cavalry, age 21 years. Fort Belknap, Texas, August 20th, 1867. Slight arrow wound of the chest, 2 inches above the nipple. Treated in post-hospital at Camp Wilson, Texas, and returned to duty September 5th, 1867. Owine, Indian Scout, Rocky Canyon, near Donner and Blitzen Creek, Oregon, March 14, 1868. Slight arrow flesh wound of the left arm. Transferred to Camp Harney, Oregon. Sergeant Francis Rigby, 1st Cavalry. Rocky Canyon, near Donner and Blitzen Creek, Oregon, March 14, 1868. Arrow passed through the forearm. Treated in post-hospital at Camp Harney, Oregon. By some means, the arrowhead had been pushed back and became embedded in the muscles, from where it was extracted. Returned to duty in April 1868. Private James Ryan, Troop F, 6th Cavalry, age 29 years. Paint Creek, Texas, March 6, 1868. Arrow wound of the lip. Treated in post-hospital at Fort Griffin, Texas, and returned to duty March 11, 1868. Lieutenant Gustavus Schreier, Troop F, 6th Cavalry, age 29 years, September 20th, 1867. Slight arrow wound of the left thigh. Treated in post-hospital at Camp Wilson, Texas, and returned to duty October 22nd, 1867. Corporal Thomas Shepard, Troop F, 10th Cavalry, Beaver Creek, Kansas, August 21st, 1867. Arrow wound of the neck. Treated in post-hospital at Fort Hays, Kansas, and returned to duty